My name is Daniel Mazur. I grew up in the far southwest suburbs of Chicago. I was always a kid who was into science and doing things with my hands. So I knew at a very early age, actually 8th grade, that I wanted to be a physician. I did my undergraduate training at University of Illinois and my medical school and residency at Northwestern University in Chicago. I did additional training at Baylor University in Houston for a male fertility fellowship. When I was in medical school, still trying to figure out what area of medicine I wanted to go into, I did a urology rotation. And I had a great experience on the male fertility side there, which kind of ultimately led me to decide down my pathway to become a urologist. Urology is an interesting field in that not only are you a surgeon, but you actually can do a lot of medical management of patients and actually follow patients for a long period of time. Yeah, as urologists, we deal with a breadth of issues that deal with the urinary and reproductive system. So from the kidneys to the bladder to the prostate and scrotal issues as well. I mainly focus in fertility and sexual health issues for men, but we all address issues in many of those areas. When it comes to men's sexual health, a lot of people think mainly erectile dysfunction, but there are other conditions of the penis and genitals that we deal with. We also treat hormonal issues, mainly low testosterone people are familiar with, and then fertility issues do come into play with that as well. A big focus of my practice is having a specialty in performing many of those male procedures, including penile implants and things such as vasectomy reversals. When I was a fellow, they were looking for someone with some male infertility expertise to come out here, and that's what led me ultimately to come to Colorado and the Denver area. So when I'm not working, the majority of my free time is spent with my family and my wife and my 2-year-old son. Wesley is a pretty standard 2-year-old boy with some high energy. It's fun to come home to that at the end of the day. But couldn't have done any of this without my beautiful wife, Cho, and her help all through my training and with our beautiful son. When I'm not with them, my favorite thing to do is hiking. I really like hiking up in the mountains, particularly in areas such as Brainerd Lake and Rocky Mountain National Park. For me, the most rewarding part of medicine is being in a position where people can come to you for help and really open up, and you can really help them on a personal level with multiple issues, including some sensitive topics such as their sexual and reproductive health. But I think one of the most important things in medicine is individualized health care. Everyone needs something different, and I think that's the best way we can help people is by really paying attention to their specific needs.